All right. Hi, everyone. Welcome to our webinar today. Oh, we have a hand raised. Does that mean someone can't hear me, I wonder? I don't think so. Okay. Just double checking. Hi, everyone. Sorry to get derailed so quickly. Welcome to our Diapers and Childcare webinar, Meeting Families' Needs in South Carolina. My name is Kate Attilio. I'm the Legislative Affairs Associate at WREN, and I'm joined by Ayanna.
Yep.
Sorry, I've been saying it right all day. Ayanna White,
Yep.
CEO of Power in Changing. We are so excited to have you. We have a lot of really, really great stuff to talk about today. So let's get started. Are you ready?
Yeah.
All right.
Thank you for having me.
Yeah. All right. Let's, there it is. I can never find it. All right. Just a few housekeeping pieces. This webinar is being recorded. Chat will only be used by co-hosts, and this is where I'm going to shout out my wonderful co-host, Brianna Myers. She is our Director of Finance, and we love her. And she'll be looking out for questions, everything like that. So she'll be in the chat. Audience members, you can submit questions. There is a Q&A feature down there at the bottom. So submit there. Brianna will be looking. We'll go over it at the end. Also, there are live captions available. The icon to enable them is also at the bottom of the Zoom window. So we're going to go off camera for now. We're going to focus on our slideshow. I'm so excited to jump in. Okay. All right. So first, we're just going to do a quick meet your presenter. So this is me. Hi, I'm the Legislative Affairs Associate here at WREN. I went to USC, got a political science degree with a minor in environmental studies. I've been doing state politics for about, policy and politics for 7 years. So I'm really excited to be here with Ayanna, who will introduce herself.
Hey everyone, my name is Ayanna White, and I am the founder and Executive Director of Power in Changing Diaper Bank of the Midlands. We've been doing this work for about 10 years, and I have 2 beautiful children. I experienced diaper need myself, so I'm excited to talk about this issue with you guys and shed more light on it.
Awesome. So great to have you again. I'm so excited. This is what we're going to cover today. We're going to talk about who Power in Changing is, who WREN is, if this is your first time with us, why diaper need matters. Then we're going to look at South Carolina as a whole and how a snapshot of our state and where we're at. And then what's being done, how you can help, and just share some resources. So who is Power in Changing? Tell us about Power in Changing. Who are you guys?
So I began this work 10 years ago, almost close to 11 years ago. I myself experienced diaper need. As I stated before, I'm a single mom of 2 wonderful children, Seth, who is 19, and Amina, who is 11. And when I went through diaper need, I was at work on a Wednesday, and the daycare called and asked me to provide some more diapers for my child so she could finish out the week. That sent me into a spiral. I did not know or understand that, or I understood, but I did not have any money. I was waiting on a paycheck that was going to hit on Friday, and it was Wednesday. So I was going to bounce a check and just go get gas, go get some groceries, and get a pack of diapers to get me through the week. My mom ended up helping me and providing me with a $50. That's it. $50 saved me from being in debt and not having the resources, or continually to be in that cycle of not having resources to properly take care of my child. So I went to the store and problem fixed. What ended up happening is that it kept nagging on my spirit. Mm-hmm. How many families go through this? How many women enter this spiral or angst of not having these essential supplies for their families? And so thus Power in Changing was born.
We're so, we love, if you guys haven't had a chance to even go volunteer or see this facility, Power in Changing, incredible work being done there. We're so happy to have you here with us to talk about this very important issue. And I just can't wait to talk more about the work you're doing. So who is WREN? If this is your first time with us, I'm happy to introduce you. WREN stands for the Women's Rights and Empowerment Network. Our mission is to advocate, educate, research, and convene community in service to women and girls for a more equitable South Carolina. I don't think reading slides is very fun, but advocating, we mean we're going to promote policies that support our priorities, which are economic justice and reproductive freedom. We're going to educate, like we're doing now. We're going to sit down with partners in our community, and we're going to talk to you about the issues that we care about. We're also going to do research. I'm going to mention later, we have a ginormous status of women and girls report that we are so excited to share with you, where we've compiled a bunch of data that we can present to you on the county level and the state level. And then convene. So like I said, we're in community, we're partnering with community to talk about the issues and get experts to share their insight to help lead these other three spots, right? So that's what our mission is. I wanted to talk just a little more about our priorities for the 2025 into the 2026 session. So it's two pillars. We have economic justice and reproductive freedom. So when we say economic justice, we mean that everyone should have a fair chance to earn money, have a job, and live a good life. And our key policies for this session are childcare, paid family leave, and workplace non-discrimination. Our second pillar is reproductive freedom. So we want to make sure people have the access to the full range of healthcare services that they need to make informed decisions about their bodies and their futures. So that's protecting access to abortion, protecting access to IVF, and then we also want to improve access to doula and lactation services. Because that's obviously a big part of it too, right? You need to have your support. So this is where we are focusing for our 2025-2026 session. All right, so are we ready to talk about diaper need?
Absolutely.
All right, awesome. So what is diaper need? I have like a standard definition here. It's the lack of sufficient supply of diapers to keep a baby or a toddler clean, dry, and healthy.
Yes, and so building off of that, what I notice and see every day when I go into work is that diaper need is that, but also is health, education, workforce issues. It is babies without enough diapers, like me myself. When I went through my situation, you have a parent who is not able to continue work, so that affects the workforce. Even though I was willing to bounce a check at that time, the other plan B was going to call out work to ensure that I stayed home with my child and the diapers she had at home would be enough to cover instead of what she needed for daycare, so I could go to work and make money. Either way, I still would have been losing money to take care of her. Another thing of what we have or what we understand that babies without enough clean diapers are more likely to face rashes and infections. Parents, again, can't send their children to daycare without them, and they can't continue work, and moms can't work. It affects the entire family's stability. I'm a single mom, so with me taking off 2 or 3 days of work to stay at home, that would have affected us even more greatly than me bouncing the check, which again would have affected me as well. So diapers are basic necessity, and that touches every part of family's life, healthcare, education, as well as workforce.
Right, it's beyond diapers.
Yeah,
it's such a big part of health and income and staying afloat, really.
Yes.
And we're going to talk about some of, so you covered this beautifully. The access, this is important. There's health risks to both baby and mother for not having them, like you talked about with the rashes and just overall stress as a child, but also stress on the mother. And they're at risk for increased maternal depression, which is already just such at a high, it feels. And then, parents are unable to access childcare, which requires a daily supply of diapers. So I am not a mother. So I didn't actually know that like daycares and childcare centers didn't provide diapers, which of course it makes sense, right? It's a cost. well, that's why we're here, right? It's a
Yeah.
cost.
It is a cost.
It's a cost. But I was like, oh. So I had, this has been such a fun. You guys know what I mean when I say fun. Like, it's not great, but it's interesting to learn about for sure.
Yeah.
But yeah, not being able to access childcare at all because you don't have diapers was something I was not really aware of.
Yes. A lot of our moms, 90% of the families that come visit us or come to our facility are single mothers. And they carry pretty much all the financial stability for their family and also the emotional stability for their family as well. Increased maternal depression, I went through that. And that is real. That 1 second of a caregiver or daycare worker calling to say your child doesn't have enough diapers sent me in a spiral, sent me in crisis mode. Just thinking about that feeling, how that impacts when you go home, when you're trying to be present for your young baby, infant child, or toddler. And I have an older child as well too. So I'm not there. I'm not present. So it does impact the family as a whole. It could also, I would also put in there too, or just mention that it delays infant mental health as well. If you have a child who does not, or you have a mother who doesn't have resources to properly take care of their child, your child is giving you clues. It's crying more if it doesn't have diaper changes. So if you're missing these clues and the child is telling you, I need my diaper change, I am crying out to you to do that, but the mother doesn't have the resource, then that affects the child's mental health. And there's some delays. There's some studies that show that delays the child. Potty training, things like that. All of this comes into effect from something that most people seem is just a basic need, but it's essential to help families thrive.
It's really it sounds like it's a root of like the growth, right?
Yes.
Making sure that everything else can flourish.
These are not luxury items.
No.
These are things that are essentials that allow women and children to thrive. So I stress that enough because especially when I read the study on how infant mental health could be affected by not having their cues met. And the only way a baby can talk to you is through crying,
right?
Smiling. Those are cues, and they're learning from you. But if you're unable to meet those needs, then yes, there are some delays, and that's just as important. If not as important as any of the other risks. Stress, we do have a higher instances, we have higher risk of babies being neglected or abused. You have to think that all correlates with the mom being stressed or depressed.
Yes, that very good, great insight there. I didn't even think about those neural pathways that are getting, tunneled out when you're not able to answer your baby's needs.
Yeah.
Thank you. Yeah. And then of course I think we said that, but you're going to miss work in school. If you can't go to daycare, then if you can't get your child to daycare, then someone's got to watch them.
Yeah.
And more likely than not, it's that parent. And you still don't have diapers.
Exactly.
That didn't really fix the problem, did it? So we talked a lot about this as barriers to access. So when I saw that the 1 in 2, half of every family with young children struggles to afford enough clean diapers, that was staggering. Because it even, what I was reading, it was on the National Diaper Bank site. They were saying how that transcends income levels.
Yes.
Which is staggering to me.
Yeah.
I mean,
so we're part of the National Diaper Bank Network, and this was a study conducted by Huggies. And what the stat was 5 or 6 years ago, 1 in 3, and that was staggering then. But now it is 1 in 2. And so this is a recent study, and this shows that there is, like you have on here, diaper scarcity. $10 can mean make or break for a lot of families. And I know $80 to $100 a month doesn't seem as that is a big barrier, but that actually is. If you are not making, or you're making minimum wage, I'll use that, as a single mom of 2 kids, and you have to put your child in daycare, that's not a lot. And you probably are missing out on some things to properly take care of your child. Some things have to go without. We have women who go without food, or go without period products just to ensure that they have diapers and supplies for their family. So yeah, 1 in 2 families face diaper need. I faced it. It's right next to you. You never know. So I think there's a big gap when we talk about social need and social assistance. And I think the gap does come when we're not paying attention to something like material need. And when I use the word material need, I'm talking about period poverty and diaper need all in one. So,
Yeah, I mean, and it's $80 to $100 right?
Yeah.
So, because again, I kind of mentioned to you when I started, when I build these PowerPoints, I'm, talking with my peers and they said, well, 80 to 100, I'm like, but you have to take care of the kid as well.
Yeah.
It's not just in a vacuum, right? So per child so if you have two children, that's 200, right?
Yeah.
So, and like you mentioned, the scarcity, prices vary by location. So, people living in food deserts or where they can't access like big box grocery stores, they're going to convenience stores.
Exactly.
And that's going to be, a few dollars difference.
No, it actually is. And it actually is. So if you're in a food desert, and more than likely you have a Dollar General and or a convenience store, let's say that, without putting out big brand names, but you have a convenience store that's near you. What we know, and this is fact, it is because there's no competition around a $10 pack of diapers that would have 20 diapers inside of it. If the store had other competitors around, may now be $11, $12. And that is an issue. That is, first of all, very concerning.
Yeah.
And very much concerning that they would take advantage. But it's expensive to be poor.
Yeah.
It really is. You are hitting the higher cost on just about everything because you have limited access to things. I'm lucky where I live. I have a Walmart, I have a Food Lion, and I have, I don't know, a few other grocery stores like a Dollar General, something like that around me. So when I go into the store, I can see that the competitors are making sure that I am buying or I'm making conscious decisions to buy cheap or cheaper than I would anywhere else because they're fighting for my dollar. But in rural areas where that is a problem in deserts, they're being marked up more for basic necessities and essentials that they need for their child. And that does go for period products as well, too.
That's it. So hold on. I get so excited and then I'm trying to line up my thoughts. When you say competing for your dollar, I think about, wow, the train's left. I'll let it come back. And but talking about lack of federal assistance also. So you go to these places, they're more expensive, and then also SNAP and WIC don't cover it. Right?
Yeah, exactly. There is a failed in the safety net. So the challenge are that diapers are not covered by any federal or state level program, not WIC or SNAP or Medicaid. Families are left with no support when it comes to that. Diaper banks like ours, that's where they come to, and that's who they work with. We step in to fill in those gaps, but we cannot do it alone, and we are siloed. Families who depend on diaper banks to help supplement those things, diapers, period products, they depend on us, and we depend on the community, and we depend on foundations. But we also need to have the state investment. If we had a partnership with the state who would pour money into us as they do housing and food insecurity, I can almost guarantee that you would see a lot of our issues and struggles decrease, and by good percentages. And so you could see that being a positive effect. But right now, we are solely a private nonprofit. All of the diaper banks in South Carolina are private nonprofits. And I think that people don't understand that no, we're not being funded by anything other than good-hearted folks and grants, foundational grants to ensure that these families get these products.
So if you, like us, feel passionately about this and want, a decrease by even 1% is better than what we're doing now, right? urge your legislators to see about legislation to help with diaper need. And we're going to talk about some of that later. But I remembered what I was going to say. So it's competing for your dollar. If you said it was expensive to be poor. That time it takes to bounce from store to store to store to make sure that you're getting a cheaper amount. It's also a time cost that you might not have. So I was just thinking about that too. It's not just money cost, it's time cost.
Yes.
So these are our barriers to access. This is what we're thinking about: cost, diaper scarcity, and then just lack of state support.
Exactly.
And federal assistance. So let's talk about South Carolina. So I'm going to start with some facts, and I want you guys to hang with me because these are all connected. So first, I want to talk about housing, right? So 27% of renter households are extremely low income, and 71% of those spend over half of their income on rent. So then 1 in 3 residents can't afford basic necessities like diapers due to housing costs. And these hours for minimum wage earners took me out. 91 hours, 106 hours. I love my job at WREN. I don't want to work 106 hours anywhere, right? So people are already struggling to afford their housing, right? And then on top of that, food insecurity, right? So almost 700,000 of our residents face food insecurity, but many families earn just above the SNAP threshold. So they can't even get the federal assistance.
They don't qualify. Exactly. So yeah.
Even if SNAP did cover diapers, the people who need them the most still might not be able to access.
Exactly.
But notably, it does not. And then 70% of our school-age children rely on free lunch, and this is higher than the 60% national number. So we're doing worse in South Carolina for our school-age children. And we were talking earlier about the food deserts and the high cost limits access to healthy and affordable food. So in our state, people are already struggling to pay their rent. They are already struggling to eat. And you don't even have a kid yet. That's just you. That's making sure that you are housed and you are fed, right? And now we're going to kind of walk into the childcare crisis. So you have a family, and now you have to get that child into childcare. And we are experiencing just such a crisis with, availability, accessibility, and affordability. So there is one center per almost 250 kids. That's a lot of kids, right? And 42% are childcare deserts. Some counties have over 50%. So there's not enough centers, and there is not there's not any around. So on average, families will spend 28% of their income on childcare, which is huge, massive, right? So I mean, the number they give for rent is 30%, and we just saw that people are paying over half of that anyway, right? So to put those on top of each other, you're not going to have money for anything else.
No, and then in childcare deserts, you have to think are regulated childcare centers, because people will make there's a daycare lady somewhere in the neighborhood, and there's somebody who will host and watch your child for smaller fees than a regulated childcare center. But is it the safest?
Right.
Is it something that you want to? But they have to. But families have to. When I was in my situation, even going back to work, we noticed that I was referred to a daycare lady, quote unquote, and so she was an older lady. She was running a daycare. Maybe not the most legal daycare, but she was running something out of her house, and watching children. And again, this was years ago. However, it wasn't a safe spot, and I knew it wasn't safe, and I knew my child was not going to thrive there. But I knew it was a spot that my child could be there, and I can go to work. So when we talk about that in a single income, 28% of your income, that is huge. That is huge. Again, no parent should spiral because they need a $10 pack of diapers. And so that's why, diaper banks are here. That's why we're here. We're 10 years old, and we're still a new concept, and that's why we're trying to get the word out on everything that we're doing. However, this is something that really affects a lot of families. It does.
Yeah, for just a whole host of reasons. And this, I mean, the fact that, people are making median in the state, $52,000, but in order to afford childcare at all, you would need to make 115,000. Crazy. 15% of the kids are living in households where a parent could quit or reduce work due to childcare. Which is, we were kind of talking earlier about this just really vicious cycle of it, right? Which there's a really good diagram for it. Next slide, which we could just actually look at. I have the power. But if you cannot get diapers, you cannot go to childcare. You can't get childcare. You can't go to work. You can't make money, which means you can't afford diapers.
Exactly.
Right?
Exactly.
It's just this whole, this very vicious cycle. So all of these things are, you might think like they're not connected, but at the end of the day, it's the same check that has to cover all of these things, right?
Exactly. And that should make the case, again, we're part of the National Diaper Bank Network. And so when you're talking about single parents, families in rural areas, low income families, and how this affects, it does affect Black and Brown communities, but it affects us all. And I think that's where people don't really understand. It affects everybody. So we all should be outraged that, that this is not covered. We all should be wondering how families survive who don't have enough supply to care for their children, of diapers to care for their children. When you make I still would make the case how this is a ripple effect. When we invest, and I would say the state, when the state invests in diapers, it's not just helping families today, it's strengthening your workforce, reducing healthcare costs, and improving early childhood outcomes. I'm reading, sorry guys, my notes. But one pack of diapers can mean a parent gets to keep their job, a child gets to attend daycare, and that's the ripple effect that we're talking about. So this is an issue. One in two have that need. We're two people in this office right now.
Yeah.
I'm the one that went through diaper needs.
Yeah.
So this is a true stat. This is not make believe. This does affect many, many families across the state, if not the nation.
Right. It's across, like I mentioned, income levels, demographic, everybody deals with diaper need, and we should be outraged. So what is being done? I know we painted kind of a bleak picture.
Yeah, sorry about that.
Yeah, sorry, it was a real bummer there for a minute. But I have good news. There is work being done, and I cannot wait. I have some great pictures from Power and Changing. Ayanna, what is a normal day in Power and Changing look like?
So I can tell you, we serve 400 families in a month, and that's across 3 hubs. We have a hub in Kershaw County, we have a hub in Lexington County, and then we have our main office in Columbia, right off of Two Notch Road. We work with different community partners. We also have great input or out diaper drives from local organizations. There's Greek Life being represented right there. Center for Communities, they're out in Greenville. They picked up from us. And then we have the Junior League volunteers and the Junior League volunteers that come in and help get us inventory from diapers. We have 3 national partners that we work with. The National Diaper Bank Network, as well as Baby to Baby. And then we have Vital Angels, who we supply a 6-month supply of prenatal care to mothers who are just learning that they're pregnant. So we give them a newborn bundle. But the work is being done all over the state by many different diaper bank entities. And we're one of few. And that's the thing, we're one of few. So there's still more work to be done. We're also advocating for the state to invest into diaper banks. We definitely are, and I know it may feel like I'm keep saying this, but it is important. We did get a proclamation for this week, and this is Diaper Need Awareness Week, that how significant not having a supply of diapers can impact the family. So I'm one of many executive directors around the state that are going and having these open talks to showcase that this is an important issue that we really should be bringing to light, and that diaper banks, just like food insecurity and housing insecurity, should be taken seriously and invested. Because again, just like I mentioned before, the ripple effect, it affects just as many things that food insecurity and housing insecurity could as well.
Right. Thank you for the great work in Power and Changing. And like I said, guys, if you could go, the facility, I only saw, I think, your office area.
Yeah.
So I didn't get a chance to see the warehouse, but you can see here just how many diapers they have to serve our community and being there. And you also have, I want to make sure I mention, you have your period products.
Oh, yeah, absolutely.
There also, so that I read somewhere that women will forego that all the time to pay for diapers.
Yes, and this is when we first started period poverty. This is years ago, and I shared this story with you offline. But we had a young lady come in. She was not thinking about herself. She was mostly focused on the child getting the diaper. So we were able to provide that with her. That provided her with some relief. I just bought my first, or we just purchased, and I want to say this is 2019. We just purchased our first batch of bulk pads. And I offered, hey, are you interested in getting some period products? She teared up. She teared up and looked at me in my, just dead face to me and just was like, yes, I need them. And that is where it clicked for me, that period products goes hand in hand. Material need, diaper need, and period poverty go hand in hand. And it hits women the most. She was so concerned about her child, she did not think that anyone else was concerned about her needs. And something as simple as a pad made her tear up. So we were excited, and I share that story because that's why we're so happy to continue our Power Cycle program as well and distribute those items across the state as well too. But this is a real epidemic. I really think that I've heard things where like, well, what about socks and what about this? What about everything? Everything can be a need, and you're exactly right. But I think when we look at certain things like diapers to thrive, and period products to thrive, this is very essential for families to actually thrive and can affect them in multiple ways.
Yes, they're like, if mom's happy, baby's happy.
Exactly.
We talk a lot about, obviously infant health as they get the rashes and their mental health, but mom needs the support too.
Exactly.
And so, putting aside her needs for menstrual products to, take care of her baby, it's just maybe not thought about as much.
Mm-hmm.
Power and Changing has some options, by the way. I was surprised by all the different types of menstrual products. So
yeah.
you're very you're diverse.
Yeah,
we can help anybody.
Exactly. We have the period underwear, which we love to give out to schools. My daughter would kill me if she was on this, but she's not. So she started her cycle when she was in 5th grade. She's now in 6th, and that's something that she needed, the period underwear. Girls are just now understanding, especially at that age, that's so young.
Yeah.
And so you're trying to navigate cleanliness, dignity, and how to get that. So we're blessed to be one of few partners to be partnered up with Think underwear supplies, and we can distribute those to elementary schools. And then we have Honey Pot, which is kind of a all natural menthol minty pad. But a lot of ladies love them and swear by them. They're great, especially post-birth. I found that out not too long ago. But yeah, we have a diverse selection of period products. We do give out tampons as well too. It's just what the mother needs. We want to make her as comfortable as possible. The point of us is to ease the mother's or the maternal or caregiver's stress, because the stress is carried into the family unit. And when you have that, you have higher instances of abuse, neglect. So our concern is for the baby's health, absolutely. But we need to ensure that the mother is comfortable as well too.
Absolutely. Do not want to lose her in that.
No.
So again, thank you so much for all this. your website. Brianna will drop that in the chat. I believe you have the form to volunteer on there.
Yeah.
So if you are hearing all the good work and you're like, ooh, I want to get in there.
Yeah.
Absolutely. Go on the website and drop a line. Now we're going to talk a little bit about legislative solutions that we're working on here at WREN. If you remember from the top of the presentation, one of our economic justice areas is childcare. And this is our Senate Bill 47 that we're supporting, introduced by Senator Tom Davis. And this is so WREN's big dream, big goal is universal childcare. This will be one of the building blocks, right? Because if we can help with childcare, we can help with affording diapers. So this bill would offer tax incentives to businesses that start or operate childcare programs for their employees. So we're going to incentivize businesses to try to fill this need, right? And then it also provides tax credits to the childcare workers. And it's a tiered system based on their training and experience. So we want to support the people that are actually doing the work. Like we mentioned before, there's a scarcity issue, but there's also a staffing issue, right? You're going to have these poor, like burnt out childcare workers in these like not enough facilities. So we want to support them and give them incentives to join the career so we could help with some of that staffing and then also help with their wages, right? This bill had a committee hearing. You're seeing this lovely picture with all the child care providers. And we have Senator Tom Davis there, and we have our Chief Strategy Officer, Ashley Lito, in the corner. And it was a great hearing. We had a lot of great support. Oh, Ross Turner is in the back. I better shout him out too. But we had a bunch of people come out, speak in support for the bill, but it did not receive a vote. So we do have an action link to send to your legislator that you are in support of this bill. And it's on our Act Now page, and we also have probably a direct link as well. Just letting them know, like, hey, I love this, and I would love another hearing because we would love to get an advance vote to move this further along the line and get it into being law. I also want to make sure I mention there is a House bill that is working on removing the sales tax for diapers, right, which is another step to affordability for sure. If you recall, I believe it was last year we got taxes off the period products, so the diapers feels like a nice logical next step. So that bill has not received a hearing. I don't believe it's still in the introduction phase. So again, like I mentioned before, if you are listening to this and you're like, we've got to do something, which I hope you are, call your legislator, ask them, let's get that sales tax removed. Let's invest in our diaper need to alleviate some of the stress on mothers, so we can alleviate stress on families.
Exactly.
I love this picture. I just go, look at them, look at the cute little kids. Wow. So we're going to talk about how you can help. So I kind of touched on that here just a second ago. This is join trainings, webinars. Congratulations, you're here. I'm so happy. You're already doing it. And take letter writing workshops to build your advocacy skills. Our lovely community and partnerships associate, her name is Aisha. She's my ride or die. She does incredible Advocacy 101 campaign or presentations. She also does a killer letter writing workshop. So if you're interested in any of that, you can reach out to me. You can reach out to her. I'll get you guys connected. We can set that up for sure. You can also take quick actions using the Action Center on our website. There is not just our child care bill, but there's all of our legislation. So I hope you like them all and you want to take action on them all. But you can find the child care bill there also, specifically. And then also sharing your story, talking to your friends and bringing them to events, which little asterisk on that. We'll talk about an event I think you can go to soon. But sharing your story. Ayanna shared her story, and now she has Power in Changing, and she's making a big splash rather. And it started there, right? And so that's so important.
Yes, it is, and basically sharing my story really did inspire myself. Not trying to put too much on patting myself on the back, but it did inspire action. And so when you share your story of even you don't think it would resonate with people. And I was surprised that when I was embarrassed to tell people that I was willing to bounce a check to afford diapers, and some people were like, "No, I've done that before. Maybe not for diapers, but for other things that I desperately needed." So it just shines a light that this is a feeling that a lot of people feel when you are in desperate need of stuff. So you can inspire people to change. You can inspire people to action, and this is what propels these work efforts to affect the community and build a better state. That's all that we want is a better state for everybody, for all families.
Yeah, that is so true. You are not alone, and like having those conversations and building those coalitions together are so important. And so stay ready to act when the General Assembly returns. So we're not currently in session. We are in that middle section between our two. Let me back up. We have a 2-year session. We had the first year from January to May this year. Next year it'll be January to May. Then it'll end our 2-year session. So right now, that doesn't mean they're not working. That doesn't mean we're not working. When they come back, they're going to start moving legislation. So stay on the standby and ready to intervene. And we will let you know and keep you updated as things come up in the off season. And then moving to this. So South Carolina is having its Committee on Children hearings. It's kind of like a like a tour, like a listening tour. They're going to 5 different places. I put them on here. They're going to be in the State House. They're going to Florence, Greenville, Charleston, and Aiken. If you want to talk there, it's testifying. It's open to the public. The public is encouraged to come and testify. You can discuss any children's issue. WREN will be there. We'll be talking about childcare.
We will be there.
Power and Changing will be there, talking about diaper needs, and so you can discuss any children's issue that is close to your heart. You just need to register in advance, and you need to include your name and where you'd like to testify. If you need any support with that, please feel free to reach out. I'm happy to help. But yes, this is a great opportunity that if you were talking about diaper need and you're like, I need them to know about this, we'd love for you to come to one of these meetings and share that with the legislature. So this is an option. Again, if you have any questions, I'm happy to help you figure out who to email. If you want me to read your testimony and like give feedback, totally fine with that too. I'm here to help however I can. And then I'm just going to drop some resource links here. Brianna has them also, so she'll drop them in chat. You'll also receive them in your follow-up email. So don't panic if you're like trying to write them all down. It's okay. So we have Power and Changing's website here. That's powerandchanging.org. Is your socials also just Power and Changing?
Yes.
Or did you have to put any fun things in front of it?
No. Instagram, I know.
Yeah.
and we're verified too.
Yeah.
Yeah, on Instagram and Facebook, that's where we have a lot of activity. I haven't figured out X or any other social, TikTok or anything like that. So we're not there, but we're definitely on the old school Facebook and Instagram.
Find Power and Changing, Instagram, Facebook, and their website.
Yeah, our website.
And WREN, we have our Action Center. So like I said, that has all of our actions that we've set up for all of our legislation. So we would love if you took some actions there. It connects you immediately to your legislator, both your senator and your House rep. You just need to put in your address. If you also want to write a letter, if you're unsure of how to find your legislator, on our YouTube channel, we have a bunch of different training videos to show you how to navigate the State House website and the app. That's right, the State House has an app. It is the worst and the best. I love it. It's great. It makes tracking legislation very easy. It'll send you push notifications, but unfortunately, it will send you push notifications. So if you need any assistance with that, we have walkthroughs on our YouTube page. We also have advocacy resources with our bill fact sheets that gives you information on all of our different bills, and then also tips on how to write testimony and just all of our other toolkits for any of your reference. So yeah, I think next it's just our Q&A section. Do we have any questions? It looks like, oh, it looks like the chat has been popping off. Good. Um,
Hey ladies, it's
hey.
Ayanna. I just want to shout out some participants. I had a couple questions that didn't make it to the generalized chat because the setting was a little weird. But Glenda, she's one of the participants today, wants to know, I know that Ayanna was talking about period products and other resources that Power and Changing have. But what about wipes, like baby wipes? Is that also a resource provided? Or what are the statistics around that?
So baby wipes are just, that's hand in hand. When we give out a diaper package to a client, they automatically get wipes. So that's embedded in our budget. That's what we purchase. We also purchase hygiene wipes for the period kits when we give them out to schools. We don't give out women's wipes for just a pack of pads or a pad kit. But yes, that's embedded in wipes are included with diapers.
That's a great question. Great clarifying question. I'm not aware of any like statistics off of the top of my head, but I'm sure it goes hand in hand with the diaper need for sure. Great question. Thank you.
And then one other one we have here is from Glenda again. She just wants to know, I know you mentioned 3 national partners about diapering or diaper needs, but are there any other organizations, state and then outside of the state that people can contact or reach out to as far as like partnerships and things like that?
So just like any national partners outside, I know we mentioned the diaper need network. I can see it in my head.
No, the diaper bait network. They're connected real close to Huggies. Shout out to Huggies, Kimberly Clark. They definitely have a moral stamp. They donate tons, and when I say tons, I mean millions across the nation of Huggies. And they're very involved in this issue. Baby to Baby, who is one of our partners, is another national partner, of ours. They're out located in California. They have a slew of celebrities. I think they named Serena Williams as their person of the year. They have this big shindig that does a lot of fundraising. And the 2 owners, they're very sweet women who own that organization. What I'm trying to get to is that they have a great partnership on their board with Honest Diapers, and I think that's a celebrity-owned brand as well, but we also get those diapers as well too. And then Vital Angels is out in California as well, and they are deal with a lot of prenatal care, and they'll be here too in October interviewing, doing with some of our participants just to see how their vitamins are doing. And this is going to turn into a Walgreens ad that'll be run up and down on the Southeast. So, I mentioned the subset of the people or the type of branding that we use, especially Huggies, because it's good that if you're purchasing these products, they are taking your dollars and they're putting some money towards social advocacy and social awareness on this need. So Honest Diapers, Huggies, Walgreens, Vita Angels, things like that. Also, By Heart is a new formula that we'll be carrying to give out to families in need. They're pretty pricey in Publix and Target, and they're pretty new on the scene. However, they're willing to push into our advocacy efforts when they're talking about food insecurity, even baby food insecurity. So I'm naming all things. You by Kotex, Honey Pot. So these are all social activist organizations that I think I'm proud to say that we are a part of that. Even if it's a small part, we're able to give that to our clients.
It's good to know that there are brands putting some bang behind their buck.
Absolutely.
For sure. It looks like Brianna says that that's all she diapers for son.
Good.
So endorsed by Cases.
Yeah.
It sounds like. Do we have any other questions, Bree?
No, that was it.
Awesome. All right. I just want to thank you. I want to thank Ayanna for coming out and hanging with us and chatting about this. again, doing great work at Power and Changing. I cannot say that enough.
Thank you. And I do want to leave with just a small closing because I had notes and I wrote down stuff. So I'm going to read it. So forgive me if I messed up. But we are grateful for every donor and volunteer who supports our work. I'm grateful for you guys being on. And thank you, WREN, for having us here. And thank you, Katie. I really, like, you're so personable. I love it. And I really do appreciate making me feel comfortable. But shining a light on this need is just the first step. South Carolina, I'm calling to action. I really want to say that the state, on all the issues that women and children have, I think we should also see diaper banks as partners in building stronger families. Just as the state invests in food and assistance in housing, it should be diapers and period products as well. And because children who have a healthy start and families have dignity, it just benefits our entire state. So I want to leave you guys with that. So urge your legislators and people in all of the topics, because they all go hand in hand. And it can boil down to basic needs and material needs like diapers and period products.
Absolutely. Thank you so much. I do have, you said hand in hand, I'm going to make sure I mention to you guys, we do have an abortion ban getting a hearing on October 1st. It's Senate Bill 323. It's at 9:30, October 1st. Then expert testimony will start at 1. If you are available, if you're able, we would love for you to come out and speak out against this harm. I mean, calling it an abortion ban is very reductive. This is a very, very dangerous bill that, you know, criminalizes not just doctors, but your neighbors, your families. Very dangerous bill. And we encourage you, we have our action link for you to connect with your senator directly. We also urge you to send in written testimony, call, email, tell your senators that you do not want this ban for South Carolina. Wanted to make sure I mentioned that before we go. But thank you again, everybody, for being here. We appreciate you and appreciate your time. I hope you have a great rest of your Wednesday.